Well, as we know, more than 115,000 Americans have recovered from COVID-19. We have some of those amazing recovery stories right here on News Now.
In HealthWorks, the Clarkston couple is expecting twins by C-section in May, but those baby boys decide to arrive early at Beaumont and Troy. Here's the problem. Both parents are fighting coronavirus.
Hi, Mikey. How are you?
A nurse feeds a newborn while a mom sends him all the love she has virtually. Pictures of Jen and Andre Laubach show delighted parents-to-be, never guessing coronavirus would keep them from their newborn babies.
We didn't get the call that I was actually coronavirus positive until about 10 minutes after Jen's water broke.
Andre is too ill to drive.
I felt like I was fighting for my life at that point.
You know, we have to leave to go to the hospital, and I'm saying, Andre, can you drive? And he's just sitting on the couch, just can't talk, I mean, the look on his face was heartbreaking because it just told me everything. It was this look that I want to go with you, I want to be there with you, but I physically can't do that right now. And so, got in the car, drove myself to the hospital.
Although she hasn't tested positive at this point because of her symptoms, Jen is treated as though she has COVID-19.
My doctors did tell me that I could have one support person there. I considered it for a second, but then I thought, you know what? I don't want to put anybody else at risk of catching this disease. So I just decided to do it on my own.
But that delivery room was far from empty. Jen finds herself surrounded by teams covered in personal protective equipment, providing medical care and loving comfort.
Every time they came in the room, they had to wear 2 face masks, you know, an N95 plus a surgical mask, plus the face shield, plus the hairnet, plus the gown, 3 pairs of gloves, booties. And every time someone came in the room, they had to put all of that stuff on. I know it was really hot for them. You know, they're sweating, and I felt terrible and I felt helpless.
Remember, the goal is to protect the health of the premature twins, protect Jen, a COVID-19 positive mom in labor, and protect the teams of healthcare workers.
One of the roles that I took on while my partner was doing a fantastic job with delivering the 2 babies was for me to try to keep Jennifer as calm as possible, reassure her, let her know how well she was doing, in addition to coordinating everything within the room to make sure that we were following the processes that we put in place.
This delivery is a first for Dr. Deborah McCullough.
She had a successful delivery of both baby boys, Mitchell and Maxim, both natural deliveries. I think it was a roller coaster for her as she was in the room and her entire labor by herself with no husband, no support. But she was very happy in the end.
When you're COVID-19 positive and you give birth to twins, do you get to hold your babies?
They took them away. They took them to the other side of the room and started cleaning them up, you know, probably 15 feet away. They put them in their own room. They were quarantined from the other babies in the NICU and from everybody, basically, because they were treating them as if they were COVID positive as well.
As the tiny babies are sent to the neonatal intensive care unit, Max weighing just over 4 pounds and Mitchell closer to 3, it's here their little bodies begin to catch up. At the same time, Jen's struggling with coronavirus and dangerously high blood pressure.
Can't see my babies. I'm still afraid for my husband. I'm afraid for myself at this point because I thought I was going to have a stroke or a heart attack.
Again, the Beaumont nurses and support staff stayed with Jen and held her hand.
I mean, they were really my heroes. They were my angels.
Andre is in awe.
Her water breaks. She drives a half an hour to the hospital with coronavirus and preeclampsia, and then delivers 2 kids naturally with nobody else there.
Tongue down, tongue down.
This is as close as Jen and Andre can get to their babies. Now they feel physically fine, but emotionally, they are enduring a painful wait to bring their boys home.
It breaks my heart that we're not able to be there.
I've got some really good news. Jen and Andre have been cleared by the doctor to visit their babies. These are pictures of them meeting their children for the first time almost 3 weeks after they were born. Both babies tested negative for COVID-19, and once strong enough, they will both be home with mom and dad. That's HealthWorks. I'm Dina Santafanti.
Jeff Piles is one of those people. He's a helper, an everyday hero. We caught up with him delivering lunches to students in his Romulus neighborhood.
I'll see you later, okay?
Thank you, Jeff.
You're welcome.
He's a father and husband and a caterer at the airport. When he gets off work, he does this. And until a few days ago, he was also doing this, visiting his mother, Sarah Piles, through her window at Beaumont Hospital in Taylor.
They put a star in the window. We were able to come up, and that was our way of being by our mom's side.
Each day, his mother's nurses would help Jeff and his 4 siblings and their families to spread joy and send their love to their 86-year-old mom in the ICU with COVID-19.
She would whisper in her ear, said, your family's outside the window singing, or just, they're here again.
Sadly, Sarah Piles couldn't beat this virus. She died Wednesday morning.
My mother was so amazing. We all love the Lord, and we know there's a better place, and our mom's in a better place. The virus is real. You know, just keep your social distance. Just do what our government is telling us to do. You know, just be safe. Just be safe in whatever we do.
Jeff mourning his mother, sending a message about safety to all of us, and still going back to the hospital to again spread joy and send love, this time to the nurses who cared for his mom, with a sign that reads, "From the bottom of my heart, thank you for taking such wonderful care of my mother, Sarah Piles."
We didn't have March Madness, but we got Nurse Madness, and it's all over. Thank you to all the nurses all over, but here at Taylor Beaumont, since you took care of my mom, Sarah Piles, me and my family are so gracious, and thank you so, so much.
His gratitude did not go unnoticed. On this day, he surrounded the sign with hearts while the nurses inside sent hearts back and a thumbs up. Even in a time of terrible loss, this family taking the time to say thank you.
Just because we lost our mom, our battle, the fight still continues on. These nurses are still in the game again. Countless days and nights just coming in and out, knowing what they could take home to their families, you know, but they're here doing the job. And I just want to say thank you. Thank you. Thank you.
In Taylor, Amy Lang, Fox 2 News.
Just a few days ago, they were packing his body in ice to try and bring down a fever of 105. And so, you know, like so many others, we were just, we were hoping and praying.
But now Richard Beckerson may be on the road to recovery after receiving an experimental treatment for COVID-19. We spoke with Bobby McKenzie, who says his stepfather received a plasma donation at St. Joseph Mercy in Ann Arbor as part of the Mayo Clinic's convalescent plasma program.
I'm not a medical professional, but I can tell you that he got it late Saturday night around midnight, and he got out of the ICU yesterday. And so we're talking about within 24 hours, there was, visible improvement.
The plasma donation was from a former COVID-19 patient who recovered from the disease. The idea is that those who beat the bug likely have antibodies in their blood that's able to fight off COVID-19. And by giving that plasma to patients still struggling with the disease, they too might be able to recover. Dr. Muhammad Arsawala.
I have, in our urgent care centers, we have total to date, we have about 85 cases of COVID positive cases. And a lot of them I have been treating and managing them. And a lot of them are healthy individuals who are young and healthy who got infected with the COVID virus, and they actually healed and they recovered from it. So I actually told them to enroll into this registry that is created by American Red Cross.
Those eligible for the treatment must be hospitalized and have severe or life-threatening COVID. St. Joseph Mercy says they don't know if this treatment will or will not help people with COVID-19 or if it will have any harmful effects. But right now, it's one of the only treatments they have.
One of the main limitations of plasma therapy is that it is incredibly time-consuming and robust to produce, right? You need people to have proven immunity in very high numbers.
The more people that donate plasma, the more trial tests they can do to know with precision when plasma helps. Does it help early on? Is that best? Could it also potentially help people who are on the front lines, nurses and doctors who may be in contact? So the more folks that give plasma, the better place that we will be in.
What amazing stories. I always love to see those heartwarming ones from our stations across the U.S. Again, more than 115,000 people here in the United States have recovered from COVID-19.